So my clinical day today was a good day. I was on night shift for the very first time, so it was very different to me. So what I would say was it wasn't as busy as how day shift usually is, but I did got to do many things. I was a helping hand to my nurse. I was able to just lend a hand to her with administering PO medications, also just flushing IVs that whenever we go in patients' rooms, and also just trying to help around to any of the other nurses who need help with just satisfying simple patient needs. Maybe getting water to the patient, comforting the family members. So I will tell you about a patient that was interesting. I had a 45-year-old female. She was admitted for starvation. She refused to eat for over 10 days. That result in her having weight loss, and also she has a loss of appetite. She also was positive for constipation, so she's been developing constipation. Her last bowel movement was about 2 days ago. She is another reason is for anemia as well. So for her, she has a history of cerebral palsy, and with this, it was at birth. So she was born with that. She's also quadriplegic, seizure disorder. She has a right hip arthritis and also dysplasia. So as far as her vital signs for her, they were Q4. We had to check them every hour. Eventually, it got better. Before her vital signs were at 142 over 89. But they got better, so it went down to 127 over 78. So just actively checking her vital signs every hour, every 4 hours. She also had neural checks every 3 hours because she was alert and oriented times one. And speech was a little slurred, but for the most part, she is nonverbal. But we just do neural checks for her, just make sure she's moving around, know where she is currently. Um, Many of the communication was through her mother. So her mother was there to provide us with like things that happened at home, and just medications and certain things. She was nauseous a little, so she was prescribed Zofran for that. Um, and then I will say she wasn't eating, so there was an NG tube inserted on the right nose, the right nostril. That was inserted there to help with her getting nutrition. Um, as far as doing an assessment on her, I was able to perform an assessment. However, her feet were red, and it had like minor little blisters on it. So another thing that we wanted to do for her was just prioritize foot care. She had many diagnostic scans. She had a CT scan, which showed the constipation was acute. She had an X-ray of the chest that showed thoracic dextroscoliosis, so mild upper thoracic dextroscoliosis, which basically is just scoliosis. That's something new I learned. She also was positive for STI. I'm sorry, UTI. And then she had X-ray of the KUB. Her lung sounds were clear, no gas obstruction. But it was just nice getting to talk to her mother, just trying to provide comforting care to the mother because she is going through a lot with her daughter um, in that situation. So that is a way that I did demonstrate caring and compassionate during my shift. Just trying to actively reach out to the mother, seeing if there's anything the mother needs or if the mother has any concerns. And as I was administering the medication, the Zofran for nausea, I made sure to provide education on that, just to provide the mother with comforting, to let them know that we are taking care of her daughter. Um, considering that the daughter was nonverbal. Some key takeaways I would say is something really cool I got to see was also performing wound care. I was able to observe a man came in, he got a wound on his right lower leg, the tibia area, and it was like a protruding wound. So it was very, very nice to see that and how they packed it and covered it up and wrapped it for him and took care of him. That's very interesting. And another key takeaway is I would say documentation. Things can kind of pick up just because it's night shift. Things still can pick up. There was a lot of admissions coming. So my nurse was trying to prioritize documenting things so she's able to tend to the new admissions that come in as well. But overall, it was a good day. Thank you.